not dying?
Hey sis, welcome to the Mama Trauma Barbie podcast. I'm your host, Alicia Wagner, and while I'm tough as a mother, sometimes I know we're all out here, tired of needing to be one. Buckle up as we land the mothership and all things motherhood in the real world. Before we move on, I'd like to thank the incredible sponsors who saw an opportunity to support women in their day-to-day journeys by joining together to make this podcast a reality. Thank you, Precision Chiropractic, Jennifer Pansition with Edward Jones, Dutch Maids, the Avalon Foundation, and Chica Creative for believing in better care, better support, and better outcomes for mamas and their families in the real world. The information provided in the podcast is for general informational purposes only and should not be considered a substitute for professional medical, health, or nutritional advice. Hey friends, I am so excited to introduce you to my next guest, Dr. Taylor Mainous. He has helped my family personally, and I am now so excited to introduce you to him. Dr. Mainous graduated from Chiropractic School from Palmer College in 2016, specializing in the Blair technique. After he graduated school, he moved to Montana, where he worked for one of the largest upper cervical chiropractic clinics in the country. In 2017, he moved to Perrysburg, Ohio to start his own practice, Precision Spinal Care. His practice specializes in structural correction of the spine through the Blair technique, as well as pediatric chiropractic. Dr. Taylor is married to his wife, Chelsey, and has 3 wonderful children with one on the way. He enjoys the outdoors, golfing, and spending time with his family. So please help me welcome Dr. Taylor Mainous. Hey, friend.
Hey, thank you so much. That was a wonderful introduction there. First, I just wanted to say thank you so much for having me on. When I first got the request or the invitation to possibly join you on the podcast and just be a sponsor, it was an immediate, yes, didn't have to think about it, zero hesitation. I just appreciate you and what you're trying to do in helping other people so much. So thank you for having me on.
You are so welcome. And let's stick with that for a second, because you were one of the first sponsors to commit. And, that just goes to the point of this podcast, which is allyship from other men. And it meant so much to me, right? I sent the sponsorship packets out to a handful of people because, let's be real, this was my first season. And I sent it to individuals that I knew who were just going to trust me to fail forward through this and give me all the grace and mercy. And to your point, understand what my mission is, but also understand it's season 1 and work with and alongside me through this. So it was so powerful, right? I send you the text message, hey, Taylor, here's the packet. Let's talk about this when you find some time. And I don't even think, was it 5 minutes? I don't even know. It was not very much time. And you literally sent me back a text that said, absolutely, I'm in. And you understood the mission. And so that means so much. So why don't we start there? I mean, you committed to be a part of this podcast, the Mama Trauma Barbie. It's traditionally something seen maybe only for women, but why did you commit?
Well, as you know, I have 3 kids and another one on the way. So I think just being in the thick of it, I understand the help you're trying to provide. And it's, like I said, an ally. I couldn't say a better word. That's what I wanted to do when you said that. It's like, oh yeah, I'm there. We're here to help spread the message and just help moms and the whole family unit, honestly. That's where it all starts, right? To have a happy, successful life, it starts with the family.
Yeah. I feel too that in this day and age, right? Like you and I have just gotten to know each other over the past couple of years, and I see you in the office and we talk regularly about a lot of things, but I think what's so cool is I know for a fact, without us even having talked about it, that you and I probably don't fully align on everything, right? Whether that's politics, spirituality, business. Right. But what I've always adored about watching you with your clients and with humans in general is where you meet them where they are. And so I just want to thank you for being a sponsor of this podcast. Again, coming beside me, coming beside the women in our community and across the country, even who are listening to this, and understanding like, look, we don't have this all figured out, but we're going to get at the table and we're going to try, because that's better than the way that it's been going out here. Right. So I think we all have a ton to learn from each other. And I know today we have a lot to learn from you. So chiropractic has an interesting connotation to it, or belief system, for a lot of people out there. So I'm excited to go over what is chiropractic today, how it changed my life and our family's life. I'd love for you to explain a little bit more about it, the different approaches, and then the different ways that can help people. So bedwetting, earaches, headaches, reducing constipation in children. You know, so many people think that chiropractic is just back pain, but it is so much more than that. So why don't you start us off with your story and, tell us a little bit about who you are and how you got into this?
Yeah, man. So many good things you just touched on, right? So let's see if we can kind of condense it down. So just kind of like the bio said, graduated chiropractic school in 2016. I was recruited to that upper cervical office in Missoula, Montana, where my mentor out there just was able to learn and grow so much from him. And that really started my whole journey on upper cervical chiropractic. A lot of patients don't realize that there's over 300 different chiropractic techniques. It's like a little overwhelming, and they all have different goals in mind. Similar helping the patient, but differences in their goals and the philosophy within the technique. So it can get a little overwhelming at times. And I think, honestly, that's one of the things that has held the profession back the most is the difference in technique. So, we have a philosophy in my practice where we start in the upper neck. Similar, we want to help the whole spine, but we're really keying in on that upper cervical spine where the brainstem sits. So that's where I got my start out there in Missoula, Montana. I was one of 6 doctors in the clinic out there. We saw over 1,000 patients a week. I mean, just a very high volume. And I was the only one that wasn't family. It was a very unique setting. And I just was able to learn so much from that. So then fast forward to 2017, I always wanted to have my own clinic and work for myself, which was wonderful. I started Precision Spinal Care in Perrysburg, and early in 2017, my brother was able to join me, which was great, Dr. Mainous, and he worked every day at the office with me for a couple of years before venturing off and running a different clinic. So now it's just me, and for the last almost 6 years, we have just been spreading the upper cervical message and how that we're different than traditional twisting and cracking chiropractic.
So I love one time when I was in and you told me this was almost by accident that you got into it, right? You showed up at a chiropractor with a friend and they asked if you wanted work done, and that's kind of how you got here.
Yeah. Wow. You have a great memory. Yeah. So
my husband would agree. My husband would agree with that.
Of course. Yeah. I think he has said that to me.
Yeah.
He has mentioned that.
Yeah. He is a patient of yours as well. Uh-huh.
Yeah. So yeah, I was going to go golfing. This was when I was still a senior in undergrad, and I was actually studying pre-physical therapy. And my friend, his sister is a chiropractor, and I was riding with him. And he said, "Well, I'm going to stop and get adjusted before we go. Is that okay?" I said, "Yeah, that's fine." So we went, and I walked in the door, and she starts, doing her assessment and working on him. And I've never been. I didn't grow up going. I didn't know anybody that went to the chiropractor. I mean, it was very foreign to me. And so I'm watching her. I'm like, what is this lady doing? And so she finishes up with him, and he jumps off the table, and he's, "Oh, that feels good." And she turns and looks at me and says, "Would you like, me to check you and adjust you?" And I was like, I was 22 at the time, no pain, I don't know, 22-year-old, didn't have any symptoms or anything. So I said, I don't hurt anywhere. And she's like, "That's all right. Just get on the table." So I climbed on and she did her assessment and she used the activator technique. And so she did her little assessment and some adjustments. And I got off that table and I could not believe how different I felt, even though I wasn't hurting before. And I think my actual words to her was that I feel like I could climb Mount Everest. I said, "What did you do? I feel really good."
Was your golf game better that day?
No.
But you did feel better, and that's all that matters.
Yes. My golf game has never been good, so I don't think adjusting is the key there. But later on, knowing what I know now, it's like, oh, I understand all the physiologic changes that happened, why my brain kind of felt like I was just like, ooh, something is really, really good. So now I understand all that. But at the time, I could not. It was just the oddest thing to me. And I had always wanted to be in healthcare. I started off pre-medicine. I switched to physical therapy because I love sports and athletes. I thought that would be really great to work with. And then I just kind of, like you said, by accident or, fate, divine, whatever, I just kind of fell into this chiropractic course, that path. And like I said, we didn't grow up going, but we were always, just a little more holistic, I would say, than the average family. Just growing up, we tried to visit our doctors, as little as possible in general, which I think most people do. But so learning, I don't know if I told you that this or not, but the very first lecture of chiropractic school, I said, oh, I'll apply. And I got in and I'd only been one time, and so I'm sitting in this room. It's 8 a.m. the very first morning. There's probably, 300 or 400 other students in there, and a very elderly gentleman up on the stage lecturing about chiropractic philosophy. And he's a few minutes in and he says, who here in this room whose life has been changed by chiropractic? And I probably wasn't the only one whose hand didn't go up, but it felt like it. And everyone's hand shoots right up. They've probably got family that are chiropractors, or a lot of people get into the profession because it's helped them so much when they were younger or whatever. And I'm just sitting there and I'm like, my hand's not raised. And that was kind of how I got started. I mean, I just didn't really, I kind of fell into it, just like you said. But growing up, I worked construction and always using my hands, and I wanted to be my own boss. You can ask Jared Blake, because I know you know Jared as well. You can talk to Jared. I just don't, I was made to work for myself. I don't work, good under somebody. But yeah, so it just kind of followed everything that I believe in, and it was really a perfect match. And I'm just so grateful.
Yeah. Well, I'm grateful that Kelly Laser, our mutual friend who is a photographer here locally in Toledo, who is ridiculously amazing, but I still own the rest.
Shameless plug.
Yeah, shameless plug, because I'm so excited that she got us introduced. Yeah. But I just remember, it was in the early days of really starting to figure out what was going on with my daughter's health. And Kelly had came into the restaurant. We got to chatting, and she's like, you should really go check out this cat, Dr. Taylor, over here in Perrysburg at Precision Spinal Care. And you know what? I'd been to some other chiropractors. I had been to chiropractic, and I knew the value in it. But, I think what a lot of people need to keep into consideration is a couple of things here. One, if you've been to a chiropractor before and you've had a bad experience, it's kind of like any other doctor, right? You've been to some good ones, you've been to some bad ones, or maybe you had a good experience with a therapist at one time, but bad with the next, but you keep trying, right? Because you need or want that type of care. And I think chiropractic's very similar. I have noticed, though, that chiropractic gets, a bad rap. Like somebody has a bad experience with someone and it's like they're washing their hands of the whole experience and they're not willing to return. And I think that's really sad, right? But, as I'm talking with Kelly, she's like, with what's going on, her daughter had some similar issues with Liv. And so, for a lot of parents, especially now over the past 10 years with these childhood epidemics, like the Western medicine world has no idea what's going on, right? So for us dealing with these children who have some of these underlying issues, I was like, take all my money. I don't care who's Taylor. And if he can help me, I'm going. And so That's what I did. And I'm so glad that I did. But I think it's important that people know that chiropractic is just like medicine. There's cardiologists, there's primary care physicians, there's pediatricians, there's endocrinologists, and the same holds true over on chiropractic. So can you tell our listeners a little bit more in regards to that story, if you would like, around chiropractic, but specifically what you do and why it's different from maybe what some other people do in town.
Yeah, yeah. I try to use analogies in my practice just to help people kind of understand what you were saying. And I kind of use an example of, let's say you've never tried, X dessert, German chocolate cake, and you go to a bakery, and let's say the baker there's just not quite great, right? We all have different skill levels, and that baker makes a terrible German chocolate cake, and you try it, and you just think, who would like this, right? I mean, I never want to eat German chocolate cake again. That's terrible. And that's your impression of it. But if you go to a bakery, and the baker is very talented, very skillful, and they follow the recipe to a T, and they put their love into it, right? Then you're going to leave there going, wow, German chocolate cake is the best dessert I've ever had. I'm going to order that at every restaurant or bakery I go to. So I think that kind of experience is similar with not only chiropractors, but our doctors in general, or any profession. I mean, there's good contractors, bad contractors, right? Good plumbers, bad plumbers, whatever. Anytime there's a human element involved, there's going to be different skill levels and things like that. But yeah, to touch on your question, I would say the biggest difference is kind of in our name, precision spinal care versus, traditional twisting and cracking chiropractic. And again, I don't want to ever badmouth different chiropractors or offices or techniques. I think the goals are different. Most people associate traditional twisting, cracking, chiropractic. They've seen videos on YouTube or whatever, or maybe there's a strap around a person's head and they yank and pull the Y strap. They kind of associate the general term chiropractic with that. And a lot of providers think the same thing, right? So when their patients say, well, what about chiropractic for neck or back pain? They think, oh, I wouldn't go that route, or they just flat out say, don't do it, very sternly, because that's what they know of it. But like I said, many people just don't realize that so many different techniques and philosophies. So in my opinion, the twisting, cracking, traditional chiropractic is, definitely better than taking an opioid for back pain, or any type of surgery or a steroid injection, which is actually very harmful to the joint over time. And I think people are becoming aware of those issues because of the internet and Google, and you can, Google what does a steroid do to a joint long term. But for us and what I do at Precision Spinal Care is no matter what symptoms the patient has, that's the number one goal. We always want to reduce the symptoms as soon as possible. That's what brings people in. But the second goal is all about longevity of those joints and longevity of the spine. And I think most people would think, hey, that's a great thing. I want my spine or my back to be good and functioning well so that I can maintain a high quality of life over time. Obviously, as you know, when we talk about the back and the spine, most people think of it mechanically, pain, loss of range of motion, tight muscles, whatever. But you and I kind of know, which we've talked before, is the neurologic component of the spine and how important that is. And most people don't even, it's an afterthought. They don't focus or worry about how well their nervous system is functioning. It's just pain. Can I do it? Can I walk? Can I turn my head to check my blind spot when I'm backing out of the driveway or changing lanes? But I think even more importantly is the neurologic component to the spine. The nervous system coordinates and controls all other systems in the body, everything from social to emotional to fine motor control, gross motor control, gut-brain connection. Like there's so many, immune function. It doesn't matter what system we're talking about in the body, it is coordinated and controlled by the nervous system. So it's paramount in my opinion.
Yeah, that was one of the areas where when my friend referred me over to you, and I heard an analogy as well along the way, and where it clicked for me and why chiropractic was so important or complementary with some of the other modalities that we were also using for live. But when I heard that your body, right, when it's under that constant level of inflammation, it's like a bear is chasing you every single day. And your body is in that heightened sense of awareness. And so it, like you said, it disrupts your immune function. It disrupts your mental health. It can disrupt your ability for good detoxification or methylation, right? With getting toxins out of your body. And so when it got explained to me that way as a mother, I was like, okay, this makes more sense. And so, I also think that a lot of people, it's like, well, we're seeing our physician and we're also doing this. And when I heard that the nervous system was boss of the immune system, it's why I took chiropractic and moved it closer to the top of one of our modalities that we wanted to use. And it's when we started doing that we started seeing better benefits with Liv. And so, I'll give everybody an example. She came in, maybe it was last week or even the week before, but she was kind of having an off week. And I'm like, great, I'm like, we haven't changed anything. I don't think that she's getting sick, and she wasn't showing those symptoms. Well, lo and behold, we come in and her neck's out of place. And guess what? She went completely back to the way that she was the remainder of that week and since then, because her neck is back in place. And so maybe you can explain to people why that is and why this upper cervical approach is, really beneficial for people along maybe some other modalities that they're also using.
Yeah, I love that bear analogy, right? The bear chasing you. That leads us to the autonomic nervous system. Okay, so most people don't realize. I mean, that's all the stuff that happens automatically in the body. So think involuntary, right? The stuff that your brain tells the rest of your body to do without us having to tell. It just does it. And what controls that autonomic nervous system is our cranial nerve 10. It's called the vagus nerve, VAGUS. So it comes out right at the base of the brain. It's going to come right by the upper neck bone, C1 vertebrae. And then it goes down, of course, to the heart, the lungs, and the rest of the organs. When that vagus nerve is not operating correctly or functioning normally, oftentimes from an upper neck misalignment, it will cause that autonomic nervous system to be dysregulated or dis-ease, right? So when that bone is in the correct place and that nerve is functioning well, everything's going to be a little bit easier for your body to adapt to, right? So when we're in routine, and kids do great with routine, but it seems like as soon as we break away from that routine at all of a sudden life becomes a little more difficult, especially when that nerve is not functioning normally, because that's all it is sensory information. It's calculations in the brain, computing, making all these different little changes. We're going to do this instead of what we typically do. And it's harder. All of a sudden, it's like a roadblock. So when most of the time that nerve does not function normally, that vagus nerve, the autonomic nervous system will be stuck in the fight or flight mode, which is the sympathetic half of that nervous system, like the bear chasing you, or oftentimes also use the analogy of a gas and brake pedal, right? It's like the gas pedal's just being mashed to the floor, and we can't hit that brake half to kind of regulate that nervous system. Now, we're supposed to fluctuate between those two halves at the right time, right? So in times when we need to fight or run, hey, guess what? We want that adrenaline pumping. We want that gas pedal mashed down. Now, in today's world, we shouldn't need that a whole lot, right? But usually we're stuck in that half. And it's similar, I see it so often in adults where people have difficulty getting to sleep or staying asleep throughout the night. They might wake up 3, 4, 5 times in a night regularly, and they're stuck in that gas pedal. The body is having a hard time shifting to that parasympathetic half, which is the second half of it, the brake pedal. So, and then, gosh, we could talk about sleep. Oh my goodness, how important sleep is, not just for kids, but adults as well, even on a cellular level. So when we're not sleeping well, oh my goodness, it's very harmful for the body. And I mean, you could do a little poll, just ask people, how many straight hours of sleep a night do you get? It's usually not very good, which is sad.
That was another benefit. Let's start with Jack. So he's my son. When we brought him, he was much younger. I think he was closer to 4 or 5 at the time when we started seeing you, and he had some bedwetting. And so it just kind of came on out of nowhere. And, we were like, what's going on? And so, we'd done our research. And so ironically, it was around the exact same time that we were bringing Liv to you. So I'm like, well, great. We're just going to, we're going to throw Jack into the mix as well. which is really interesting because we should talk a little bit more about the machine that you also do for screening. So here it is. I think I'm bringing Liv, who symptomatic wise seems to be the one that needs this more than anybody. But from your testing that was done, Jack was actually the one that needed it more. And so he was misaligned in a lot of different places. And, who knows, right? Boys, he's jumping around more. He's way more aggressive in his play. But I don't think it was 2 or 3 sessions with you that we worked with Jack. And, he never wet the bed again.
Yeah. Yeah. So I'll start with the tool first, right? It's very difficult. Most adult patients, it's subjective. How are you feeling today, right? That's what brings them in. We kind of talked about that, the neck pain, back pain, headaches, whatever. But for a 4 or 5-year-old, how are you feeling, Jack? He feels great, It's hard to communicate that. So we have a special tool in our practice called the Insight Station, and it uses 3 different tools to objectively kind of quantify how well that nervous system is functioning, right? Like I said, we always want the patient to feel better if they're hurting or things like that. But objectively, I want to be able to track and measure what areas I might be able to help out even more, right? All about that longevity of the spine. So we do a thermography scan. It uses infrared thermometers to measure the temperature side to side that the nerves produce. Kind of like if you leave a light bulb on, when you go to touch it, it's kind of hot, that thing, turn it off before you try to change that light bulb. Well, your nervous system works the exact same way as an electrical system. So a byproduct of electricity is heat. So we're able to measure kind of side to side, is one side producing way too much heat? Are both sides producing too much heat? Way back when, in the early days, there was actually stories of doctors putting mud on people's backs, and wherever the mud would dry first, too much heat, right? They would do whatever, I don't know, the Chinese medicine, I don't know what they're doing, but they use mud to determine which areas they were kind of going to work on, which is just fascinating. So the idea of thermography or temperature differences that the nerves produce has been around for thousands of years, right? So we use that as one tool, one method. We also do a static EMG reading, which is going to gauge the muscle contraction of the tiny little muscles that go up and down the spine, the paraspinal muscles. So based on position of the bone, certain ones might have to be way too contracted. Other ones might be taking the day off. They're too relaxed. Usually they're too tight, too contracted in most people. And kids, we always like to refer, especially to babies, but even kids, they should be floppy and soggy, right? Like when a brand newborn is, real stiff and rigid and holding their head up, it's not because they're strong. It's because those muscles are just very, very rigid and tight, and they should be nice and pliable. So we do a static EMG reading to kind of get a baseline on the muscles. And then lastly, we do what's called a heart rate variability, HRV scan. That is just some of the coolest stuff. That's where we kind of gauge that autonomic nervous system. Are they stuck in that gas pedal or the bear chasing them? Maybe they're stuck in the other half, which is kind of a little bit more rare, but they're having a hard time to switch to that sympathetic half. So we do all that to kind of get, a good objective measurement of where the child stands, because you can't really ask them how they're feeling most of the time at that age.
Life happens. You can't predict the unexpected, but you can prepare. Your Edward Jones financial advisor, Jennifer Panzician, can help you with your financial goals, planning with life's ups and downs in mind. Call 419-841-2627 to get started. Edward Jones, member SIPC. I definitely learned that myself. And so just the value of adding this, I brought up modalities earlier, and people might be wondering, well, what are some of those things that you're talking about, right? Well, you might be doing therapy for maybe, what feels like some mental health issues. But again, what you went over around the fight or flight response and maybe what's going on with the vagus nerve, therapy might be part of what's pushing the gas pedal on getting better. But, chiropractic, right, can actually, from a physical standpoint, help get that system put back in place. Or massage, that's another one that, people are like, well, why, chiropractic, they just want you to come every week because they want to take your money. And, I'm somebody that's done massage since I've been in my early 20s, and a lot more then when I had more time before I had, 2 kids, a husband and a business to run. But it's still, when I can get my therapy or life coaching, my massage, and my chiropractic all running in the same lane for my health, it's when I feel the best. And I think sometimes people, it is it can be expensive bringing all of these things together, but when you're really looking for optimal health, and this being what can help lower inflammation to prevent disease or feel well and be in a good mood, right, and care well for your family, it is a phenomenal investment. Brain training is another one. Supplements are another one. But, I often find people just want to pick one, and just kind of go with it. And based on how this works, it actually works complementary and well to be the other side of the coin for what a lot of people are needing to improve their health. So no, chiropractors aren't needing to take your money. It's just like in massage, there's a reason you go consistently to feel better. And so it's the same with chiropractic, but maybe you can add to why the consistency or the need for the multiple visits.
Yeah. Man, we got such a short time.
I know,
right?
we
Like,
could go on all day. We'll maybe need a part 2. Look, I mean, come back as a sponsor. We'll do another one.
We might have to.
We might have to.
Clear the day.
Yes.
We need a whole day. But no.
What we honestly need, that I've been thinking about? We really do need a really good health symposium, specifically in Toledo, but it'd be great to make it virtual because, I just think, again, we silo so much of this and we never talk about it well independently. Like you said, even a lot of practitioners that are out there, that they just don't understand chiropractic. But it would be so great to go through all of these and just get people up to speed. So who knows? Maybe that is something we could tackle here coming up.
That would be amazing, because when stuff like that doesn't happen, the person that suffers is the patient. Truly. So, but yeah, so lots of good pillars to good health, right? I mean, there's no one magic bullet, right? I mean, let's say I get a person's spine in great alignment, mechanically it's moving better, but they eat like garbage, right? They don't drink enough water. They're not getting good sleep. All these different, goodness, maybe they're too stressed at work, right? I mean, there's so many different avenues and pillars to good health. What's really fascinating is, kind of back to let's say you have good nutrition. You're taking supplements, high quality supplements. You're making sure you're getting enough water, good sleep. But if that nervous system is dysregulated, what tells the body to absorb what when you put it in? Your nervous system, right? What tells it what to excrete, kick out, detox? What tells it what to hold on to, break down, store for what, fat versus whatever. It's all that nervous system. So I don't want to say it's paramount, but it's pretty important, right? And most people have no clue, right? Because they think of it more traditional twist crackle, and especially generally people who are healthy or try to be healthy or trying their best, they're exercising. So they're, they might have some back pain, but they're exercising, they're eating well, they're doing these other things. It's like, man, my patients that absolutely do the best. And you can see it not only in how they feel, but the objective measurements. They're doing all those little things. And it's like, and then we regulate that nervous system, and it just, they do so much better than a patient who comes to me, maybe obese, sedentary, right? Works a desk job, goes home and watches TV, eats terrible processed foods all the time, not enough water, not enough sleep. Like, it's just a vicious snowball effect, right? So like you said, it can be, an investment is a great way to put it. Because I'll tell you, every patient that I've ever dealt with that has had bad back issues, major back problems, whether it's surgery or pain or terrible headaches, dizziness, vertigo, they all wish they had done something sooner, right? It's kind of, but the cat's already out of the bag, right? We can help, but to a certain extent. And that's why my passion comes through with pediatrics, because it's so much easier to help when the child is young versus when they get older and there's already certain problems, right? That's just a fact of life. And they heal so much. I mean, I'm so jealous of how they heal, right? Like, I wish if I knew now, back then, I would do things differently, right? Because I didn't grow up going. And man, I'll be the first to tell you, it's an astronomical price to go through chiropractic school, but I would do it over and over again just to have the ability to help my kids and my wife, right? Like my own family. I don't even know where I got off on that. What was your question?
I love your passion behind it. It's not that you didn't answer my question. Maybe there just was the part B, which was, why is the consistency so important then? I mean, I've got to think it's pretty similar to like, you're working out consistently, right? Because that is going to contribute to a better outcome. We continue with massage therapy, right? Because your body starts to get tense again, and then you have to work it back out. So, what's the jam or the magic behind consistency in chiropractic?
Yeah, thank you so much. I get sidetracked.
Me too. We'll help each other. We'll help each other through this today.
Thank you. You're like my North Star. You point me in the right direction. Okay. So consistency. Yeah. It's one of the biggest hurdles that I hear with patients. I heard from so-and-so, my family member, my friend. If I start going, I always got to go. I say, well, are you always going to use your body, right? We use our body every day. We use that nervous system every day. So as we're going through life, and if it's, work or exercising, whatever we're doing, it's hard on our joints, right? So as we use our body, it makes perfect sense to think, I might want to maintain that, right? Just like we change the oil in our car engines, right? I mean, if we got an oil change and then never drove the car again, theoretically, you'd never need to change out oil again, right? I mean, I don't know, maybe later down the road, but if you're not using it, you probably don't need to maintain it as much. But if you're using it every day, you drive that car every day, guess what? If you maintain the engine, maintain that oil change, it's going to last a lot longer versus not maintaining it, right? So again, it kind of goes all back to that philosophy of longevity of our back. I think a very old school way to look at chiropractic is, oh my gosh, I'm not going to go in unless I can't hardly walk, or whatever. I think people are starting to realize the importance of fixing the small problems before they get big, right? And so it's similar to, like I said, exercising, building muscle, losing weight. I wish I could eat one salad a month and be healthy, right? Wouldn't that be wonderful? And then I could just eat garbage the rest of the time, but it doesn't work like that, right? So similar, especially in the beginning when I'm working, whether it's children or adults, what holds the bones either in the correct alignment or the incorrect alignment are ligaments. Ligaments hold bone to bone. And if you know anything about ligaments, they're a pain in the butt. I mean, they are the biggest fighter that we deal with, right? If I tear my ACL, have a knee injury, and I blow my knee out, I tear my ACL, it's about 9 to 12 months average recovery for that ligament to heal. Now, most of the time, the ligaments of the spine aren't torn like your knee if you were to blow your knee out, but they've been in the wrong position for X amount of years. So certain ones are way too stretched out. Other ones might be way too tight. And they're not elastic like a rubber band, which is, why we do the protocol and program that I do in my office is I don't just twist and crack and send you on your way and say, come back and see me when it hurts again, right? I mean, that's very easy to do. I think that's why a lot of chiropractors practice that way. It's very easy in the patient. Oh yeah, okay, they're not trying to take all my money, right? Is it in your best interest saying that? In my opinion, it's not. So we have a very, kind of a strict program and protocols on what we want to accomplish with the patient. And a lot of it has to do with getting those ligaments to tighten up, hold the bones in the correct position, which is why we do the very precise upper cervical adjustments coupled, with trigger point therapy. I mean, it doesn't feel great when I'm doing it, as you can attest at times, right? But it really helps out to get those muscles to relax. And then we do a slight form of cervical and lumbar traction with full body vibration therapy. So we're really helping those ligaments tighten up over time once we've got the joints aligned, once we've got the muscles relaxed, and once we push that spine into the proper curvature. Yeah. So I think that's, once you've got it fixed up, then you just want to maintain it, right? It's a lot easier to maintain than correct. Yeah.
So let's talk a little bit about some of the top reasons that people see for pediatrics. And, then we'll kind of shuffle over here to adults. But, in kids, it's oftentimes, and maybe we'll just rapid fire these, right? Like maybe take, 20 to 30 seconds with each. But, how does chiropractic, especially what you offer with upper cervical, like why does that help so well with bedwetting?
Sure. So 20, 30 seconds. Here we go. Basically, it'll help regulate that autonomic nervous system, especially top-down approach. You can hammer away on those areas because most of the issues with bedwetting or constipation, a lot of times are from the nerves coming out in the thoracolumbar region. Okay, so like the mid to low back. or even down by the sacrum in some cases, some instances. So you always have to start in the upper neck. That's where the philosophy is different. If you've ever seen a seal kind of balance a ball on its nose type of thing, your spine is the seal and your head is the ball. So your spine is trying to level out your head as best as it can. And we can hammer away on those other areas, but the brain is always going to make those same calculations to try to level out the eyes as best as it can. So that's where the top down will really help, is it's going to give us a starting point on affecting below in those areas where it's having a problem. But yeah, the thoracolumbar area is huge for bedwetting. It's just a incorrect communication between the nerve and the muscle, or the nerve and the bladder.
What about ear infections? We've heard a lot about chiropractic being extremely helpful for that. So
yes, I'm actually a child that had a lot of ear infections, chronic ear infections. I had tubes in my ears on 3 different occasions. My poor mother just didn't, she just didn't know any better, basically, right? Just listen to the pediatrician. They hardly do. They'll do them every now and then, but they really don't even like to do them anymore, because your body ejects them, basically kicks them right out, which is why you have to have multiple sets. And to this day, I have problems with flying or swimming. I'll get water in my ear, and it is what it is. But essentially, they used to think the eustachian tube, the ear canal, right? Some kids maybe was pointing down a little bit more and it would help it drain. If it's a little more flat or even pointing up, they're just out of luck. They're going to get more ear infections. And I'm sure gravity will, help a little bit. But now the thinking behind it is what controls that drainage of the eustachian tube, the ear canal, is actually the smooth muscle surrounding it. And what happens is when we turn that head and neck, proper biomechanic movement of the upper cervical spine will enact those smooth muscles and help kind of like milk it, honestly. It just helps it drain. And so when we have improper biomechanics, especially of the upper neck region, that smooth muscle is not getting activated correctly, and it's not going to milk it. It's not going to drain, causes that fluid buildup. All of a sudden, it just increases the chance or the risk of ear infection.
What about ADHD and some of these sensory spectrum type disorders? How can chiropractic help children there?
Oh my gosh. Yeah. It's as simple, even though those are some of the toughest cases, and especially some of the parents and kids and families that go through the most. I hate to say it's simple, but it's as simple as regulating that autonomic nervous system, giving their body the greatest chance to deal with the adaptations with ease versus dis-ease, right? You hate to say it's as simple as that, but it's as simple as that, giving the child and really the whole family the best chance to deal with stuff with ease versus dis-ease.
What about other pediatric issues that you might see outside of the ones that we mentioned? Is there anything that you feel like we should hit on before we move on to the adults?
Oh gosh. Really young really young babies,
The babies?
like colic.
Oh,
The
colic.
babies, yes. Yeah, there's no known cause or cure right now. It's just, oh, your baby's colicky, they'll grow out of it, right? Wrong. Their symptoms change. Yes, they might grow out of the fussiness or lack of sleep, but it's going to grow into other things, right? Similar to ADHD, sensory processing. So many things. So colic is a big one for the young kids, and then constipation. Oh my gosh. So many kids just get put on Miralax, right? And kind of daily to get them to go with no thought into the future as to wean them off or try this, try that. Just, they're not going, give them Miralax. Oh, terrible, terrible. Similar with the bedwetting, it's just a dysregulation of that nervous system. So it's just incorrect communication between the nerve and the muscles.
I know this could be a really beneficial practice for families who have children who might be on the spectrum or have sensory processing or ADHD, just because they oftentimes might be on different medications. And so I think something I'm seeing out here in the sensory world is, the agreement or disagreement between parents on medication. And I'm not here to say medications are bad at all, and if there are children who might need them, but I think where it's important to take note is that some of these medications have side effects for kids. And that's why, right, an alternative like this could be important, that if your kid is one of these children who might be experiencing some of the negative side effects that might be coming with medication, that chiropractic could be an alternative to try, and that they might not only get benefit from, but they are going to see improvements as it relates to their focus, concentration, and their ability to be in school.
Yeah, definitely. My wife is a nurse practitioner, right? So I see the allopathic side, greatly needed at times, right? There are medications that save lives daily, right? But you touched on a very important aspect. Every medication that's ever been created has side effects. Even ibuprofen, Tylenol, Aleve, Advil, there's side effects. So when you start talking about class two medications, powerful medications that, yeah, at times they can help. And you're exactly right. I feel so bad for the parents because they're just trying to do the best for the child, right? With the information they're given. But that's why I jumped on board so quickly with you is these are the conversations that need to be had, right? Especially when the other providers just shoot down any alternative um, methods, right? No, take this medication. That's it. Don't try regulating the nervous system. That would be crazy, right? Um, I believe, as you put it, chiropractic or something, right?
Chiropractic. Yep. That's what a lot of
Yeah,
people think about what you're doing, but our family
yeah,
knows
yeah.
that you have moved mountains for us. And so I wanted to make sure that other families have the opportunity to learn more about what you're
Right.
doing and why it's important. And I would say, so many moms today, they're not taking into consideration the birth trauma that comes from whether it's C-section or just, the journey these babies are going through in order to get out of us. And so,
Mhm.
that can be really disruptive for these kiddos and that can cause colic. There's a couple of other, areas or things that, in regards to dairy or maybe their first vaccines and that impacting their nervous system as well. So can you go through why chiropractic is so helpful for the babes that are newborns?
Yeah, definitely. You hit the nail on the head, right? Even the smoothest birth is a traumatic event for mom and baby, really, But then you throw in things like suction, forceps, C-section, cord wrap around the neck or head. And there's got to be these birth interventions. And at times they do save lives, absolutely. But it's very hard on the baby's upper neck specifically. I've got three, one on the way. All three of my kids, I adjusted about an hour after birth, and they were very, thank goodness, normal, easy. I would say, my wife would disagree. But no complications to the birth, and still every single one of them needed their upper neck adjusted. So it's almost like starting off on the wrong foot for the baby, right? They've been through it. The only way they can communicate is, crying, right? Fussy, crying, tight, rigid. They're trying to signal, hey, something's not right. Maybe we should take a look at a safe, gentle, effective way to treat versus, I don't know, oh, they'll grow out of it. Oh my gosh, right? And a lot of the children that deal with ADHD, sensory, even a lot of the children on the spectrum, a lot of them have just seems like a unique or difficult birth process. Even sometimes it's even just even trying to get fertile, like there's a stress or infertility issues. Really, it all boils down to just a bundle of stress on the child from the get-go. And that can just lead into, just like I said, just setting them down the wrong path. But that's where chiropractic comes in, is regulating that nervous system, helping the child deal with it. And I think the colicky kids just really benefit some of the most and the quickest. Yeah.
I certainly wish I would have known about it. And I've heard and talked with many mothers along the way that have also found benefit to this. And, it also contributes to the mental health of the mother in a very way.
Yeah.
So, it's also hitting that vagus nerve and that trauma. And that's why this is called the Mama Trauma Barbie podcast. I mean, if I really went through the beginning of where I was with my daughter in this journey to where we are now, I mean, there were, like you said, it starts when they're little. And if it doesn't set them off on the right foot and it's not, then this stuff compounds and it compounds.
Yep.
And so I really, really wish that I would have known this information sooner because, would we be where we're at today? I don't know the answer to that, but I'm certainly glad that we've come across your path and that you've certainly been able to help my children and me. So let's go on to adults. I know a couple of the big reasons that people come to you are headaches. I know for me, I bite down at night. I don't grind, but I bite. And then there's just this insane amount of tension that then goes in my upper neck and my shoulders. And it just goes all the way down. So I know headaches can be a big one. I know neck pain, back pain, but what are some of the top reasons that adults come and see you?
Yeah. Um, Certainly, cervicogenic headaches. Yeah, and headaches are one of those things where, like we kind of mentioned before, lots of variables, right? Some people get hormonal headaches. Some people get headaches when the barometric pressure changes. I can't control that, right? But the cervicogenic, absolutely, meaning coming from the neck. There's so many nerves and blood vessels that kind of stem off of that. Your head gets so much blood flow. I mean, it gets so much blood flow. So if there is a malposition or a deviated from the normal alignment in that upper neck, it can contribute to decreased blood flow. It can contribute to decreased nerve flow, which is just going to be dysregulation of those blood vessels, right? A lot of people get the pounding, throbbing headache or whatever, migraine. So helping the body function like it was designed to. That's all. I mean, that's all I do is just help it function like it was made to. That's it. That's it. And when stuff is in the correct position, when your bones and joints are in the correct alignment, it just works better. It works like it was made to. It's when it deviates from normal that we get that dysregulation and the disruption of how it was designed to work. Yeah. Yeah, headaches, even like vertigo, dizziness, a lot of that can be cervicogenic. People with Meniere's disease, which is usually from a whiplash-related event or a trauma to the upper neck, even 5 to 15 years later, they can experience symptoms. So believe it or not, I get quite a few, and I'm sort of the, last resort. They've tried everything, heard about me from their crazy neighbor or whatever, and heard I was different because they've tried, traditional routes. Yeah.
You know what I also love that makes you different, Dr. Taylor, is your approach with your patients. And so I've seen it with my daughter. I mean, of course, with your other patients that I've seen, but you really do meet people where they are. And so on my daughter's good days or on her bad days, you consistently show up and meet her where she's at and leans in. And I've often shared with you, socially, she at times has challenges potentially with new people or even just people she's continuously around. And so I mean, literally out of everybody in her life, I see her interact in a way with you, and I could get emotional talking about it now. She comes up and she gets in your face and she laughs with you and she's just silly. I mean, you know that, but I share this with listeners because not only are you a ridiculously amazing chiropractor, you're a great human and you really do meet your patients where they're at. You offer something different, not just in the type of chiropractic, but just who you are as a human being. And, if people have had bad experiences in the past, I certainly think that, your practice is a safe place for people to land by not only the technique that you offer, but, by the type of person that you are who is running it. So I just want you to know that it has made a profound difference in our life, but we're certainly coming up on time. And so what do you want to leave people with? Like, what have we not talked about that might be important for people moving forward as it relates to chiropractic?
Well, thank you. For those watching, I think it's getting dusty in my room here. That was very kind. Thank you. And I just love your kids. I love your whole family. I love your kids. And I think certainly I'm one of 6, and so I'm from a big family, and that's one thing my parents always instilled in us was doesn't matter a person's wealth, income, anything. You just treat everybody the exact same, and you treat them well. And I think that's kind of what, like you said, what sets me apart is not just people don't do that nowadays. It's sad. But anyways, to leave people with, get your nervous system checked, support Mama Trauma Barbie podcast and just the whole ordeal, and help out your family. I mean, that's the most important thing. It's the most important thing. And just help out and be there for other people too, because we're all in it together. And it's, like you said in the beginning, we don't know, you're not going to ever find somebody who agrees 100% with everything you do or think or believe in. But you got to meet people where they are because we're all pretty much the exact same as people.
Yeah. Well, you love your neighbors ridiculously well. And I certainly appreciate the
Thank you.
sponsorship and helping us get this podcast out there, helping families recognize and realize that there are different pathways to good health outside of the traditional ways that we have all been taught. And so again, it has meant so much to me to have you as part of what we're trying to create over here. And, it does, like you said, take care of your families. And I think for me, having gone through, again, what I've been through and just the, nervous system dysregulation. Like you said, we're all out here just trying to do our best and we're in this together. But for me, for chiropractic, I think of you often when I'm making dinner, because we come see you on Mondays at 4:00. And it's more peaceful when we get home from those visits. And I smile, right? Because I get worked on, they get worked on. And there's, it elevates a little bit more, right, throughout the week. But I see it work. And, as stressful as life is out here, it's just, I can feel it work. And I just know it's such a safe alternative. And it makes so much sense, right? The science behind it, but also the art with what you bring to what you're offering. So again, I just want to make families aware that if you're just sick of maybe this high, energy level of what's going on in your home, it really goes back to what you said, which is take care of your family.
Yeah.
And if we're going to take care of our family, we got to take care of ourselves, right?
That's right. That's right. You got to put your own oxygen mask on before you help others, right?
Yep. Amen. Amen. Well, we're super excited that you have your 4th child on the way. And, any parenting advice? I don't know. I feel like what do you got? What are we going to leave people with? Like, what would you say? Is a good piece of parenting advice?
Yeah. I mean, I'm so young, that I don't know if I can give advice yet, but I will say, what I've noticed with my own children is they're all so different, right? One approach might work so well with one and be the complete wrong approach for the other one, which is crazy. They come from the same people, but sometimes it's like they couldn't be more different. But I'm not qualified to give advice on parenting. I'm too young. I'm just,
Bro,
I'm just a
you
kid
have
myself, so.
you have almost 4 kids. You absolutely do.
Listen, 4 and no more.
Yeah, 4 and no more. You do bring up a good point, though. I mean, I think many of our parents, right? Like, we just went through the cog of like, here's parenting, here's childhood, and everybody's going to go through it. And so I agree. I love seeing our generation just take a more individualized approach to our kids. And I think that's the hardest part of it, is we're all out here healing and trying to do a better job, but also take our kids, through a new way. And it can be difficult. And so you're right. We need to be in this together. But I think that's really good advice. Okay. So how can families get a hold of you if they're interested in working with you?
Yeah, they can go to our website, www.chiropractorperrysburg.com. They could call the office, Precision Spinal Care, look us up on Google, or the phone number is 419-873-7223. Our office manager, Kayla, goes through everything. She's phenomenal. She's really the gatekeeper, so to speak, and she just loves on people too so much. So she's wonderful, and you'll talk with her first, and then we'll sit down for a consultation.
Or they'll find you in the Mama Trauma Barbie weekly sponsorship post that comes out as well, if they'd like to find you there. So, well, Dr. Taylor, it has been an absolute pleasure. I am indebted to you and your practice and all that you bring to it, because you have certainly helped me and my family, and we are beyond appreciative, my friend. So thank you so much for joining us today.
Okay, thank you so much for having me. Look forward to the next one.
Join me next week as we talk with Janelle Massey, author and CEO of Agility Counseling Group, as she addresses the breakdown of meaningful connections and positive socialization in sports, as many children are experiencing a decrease in joy and resilience on the field and on the courts, with the exponential increase in anxiety, toxic stress, and suicide rates in children. Janelle is turning her attention towards these concerns and addressing the person before their performance. Thank you, Precision Chiropractic, Jennifer Panzician with Edward Jones, Dutch Maids, the Avalon Foundation, and Chica Creative for believing in better care, better support, and better outcomes for mamas and their families in the real world. The information provided in the podcast is for general informational purposes only and should not be considered a substitute for professional medical, health, or nutritional advice.